Well, hello, YouTube friends. It is week number 6. Yesterday was my follow-up visit for the 6-week mark, and no more sling, and I'm able to actually move this arm a little bit. He told me I can engage those muscles just a little, and gave me some new exercises, and so I've been doing those at home and with the therapist. He apparently sent the exercises over to them, and so I'm not going to go into what the exercises are because I think that needs to be done by a professional, and I'm not a professional. I'll tell you what my exercises are, and then you hurt yourself doing it. I don't want you to do that. So what my doctor has for me, he's been in my shoulder. He knows what's there, and he knows what I can do and can't do. And I've had a lot of people tell me, "Oh, try this exercise." You can't do that because if your doctor hasn't given it to you, he knows what's going to work for you. Because it worked for uh, Susie Q or Joe Blow doesn't mean it's going to work for you. Their surgery was different. They're a different person. They're a different body type. There's so many different factors. So the same doctor can do the same surgery on two different people and give them a completely different therapy plan. You got to remember that. Please remember that. So don't do therapy that somebody who is not qualified tells you to do. Enough nagging about the progress. It's really great. I'm so excited. Uh, he told me yesterday. He says you're done with the um, with the not the harness, but the sling. Brain cramp. I'm done with the sling, and I can drive again. So two things uh, happened. Battery was dead in my truck, and I did start it, but it was dead anyway. Apparently, it was just too long in between cranks, so I had to put the charger to it, and boy, my daughter and I, we rode around, and it was just so much fun. And this is going to come as a shock, and so sit down. I don't want to freak anyone out, but I don't miss the sling. I know. What a mind blow, right? I don't miss it, and I feel so good. Um, I'm a little bit more sore, but I've really ramped up on my therapy, and it's good, boy. I mean, it's I can it's only been 2 days, and I'm already seeing some gains by ramping up on it. So we're real excited, not getting carried away. I'm going to take it very slow, but I am pushing a little harder than I was before, and I have permission to do it. Um, he said if it hurts, stop. He said, but I want you to. He told me that this is my situation, not with yours. That at this point, that uh, I can push a little harder. That that he doesn't want it to hurt, but he wants me to get past where it's stiff and just go a little bit further. Just push myself a little bit, and it's okay to engage the muscles. But of course, I can't do this with it. I can, that's about it. I can go up, but it's mostly hiking my shoulder. But I can, if I'm standing up, I can swing my arm a little bit and move it, and it's much better. Um, oh, freedom, and I have actually. Oh, and I slept in a bed last night. It was really great. I tried it earlier a couple of weeks ago. I tried sleeping in bed for a couple of nights, and it just I was able to do it, but it didn't work out. Last night I was able to sleep in a bed, and it was great. Of course, my bed rises and lowers and does all kinds. It's like a hospital bed, but it's not. It's I got the purple mattress and of course we're in debt for it now, but it's really nice and comfortable and vibrates, which is great. Lull yourself to sleep, it shuts off automatically, and but that was great, and just really excited. Wanted to update you. Uh, I'm gonna go to monthly updates at this point instead of every week. My next one will be 2 weeks from now, which would be the second month, and then after that it'll be a month after that. So I'm not going to be doing quite as many updates. But I did want to do it every week. I wanted to do it every day for the first week, but I only did a few of them. And then after that, I did, week by week until right now. My next one will be 2 weeks out from here. It'll be on the eighth week, which will be 2 months, or just whenever 2 months is. That's which would be, yeah, I guess that'd be right. And then after that, I'll go to the next month, third month and fourth month, and so on until I'm recovered. Until I feel like I've had a full recovery. And I want you to really think hard about having this surgery because it's been a blessing to me. I was in terrible pain. I couldn't use my arm very much um, before the surgery. And if you're not really hurting now, you're debating, well, maybe I just won't do the surgery. But the thing is it gets worse. And as time progresses, you're going to want to have that surgery. So I want you to think hard about it. If a doctor is recommending that you get it, and they all tell you it's your decision, you know, but if you just ask them point blank, are you recommending that? Do you think I should have it? And pin them down. And if they're telling you, yeah, you should have it, do it. Because, I suffered with this for a long time. Um, the worst part was from last spring to now, or well, to when I had the surgery, 6 weeks ago. But really, I've had problems for over 30 years with that shoulder, and it's just been progressively getting worse. Don't do that. Get something done about it. Try to try to talk to somebody about it. I'm a stubborn mule. I just don't talk about ailments to my doctor until it's so bad I have to have it operated on, and I've got to stop doing that. And I have a doctor right now. She's just the best, and I go to her with my gripes and complaints, and she'll check it out. She says, well, you should be all right with that, for a while. And then I've got a knee issue, and but that it's going to be okay. And then I went with this, and we tried to make this last. It just didn't work, and tried some home therapy, and it didn't work out. But uh, that's all in previous videos anyway. So, but you need to really consider having the surgery so you're not damaging your shoulder even more than you really need to. I mean, it's not necessary to suffer and live in pain like that. You know, get this thing healed, get the therapy behind you, and move on. There's other problems going to come your way. You don't need to be dealing with this. So it's good. It's really good. It hurts. It's uncomfortable. You're gonna need to take pain pills. It is going to be a burden. It really is. You're going to have to learn how to do things differently for a while. But honestly, it's worth it. And it's not the nightmare. At least I don't, unless you have a low pain threshold. If you have a low pain threshold, it's probably going to be pretty bad. But honestly, I don't think it's as bad as people make it out to be. A lot of times people have never been sick a day in their life, and they have something like this. Oh my God, it's terrible. It's not. It's not that bad. It hurts, but you can get through it. You can do it. I believe in you. So keep the faith. Do what your doctor tells you to do. Do what your therapist tells you to do, and stay the course. Stay on track. And I'll talk to you in about 2 weeks for month number 2. And hopefully I'll be moving this arm a whole lot more. Talk to you later. Bye-bye.